Welcome to the Aesthetics Unfiltered podcast. We are Michelle Jones and Melanie Torres, two leading medical aesthetic nurse practitioners and great friends based in California. We uncover the inner workings of the booming aesthetics industry from both the patients as well as the providers' perspectives.
Join us for the authentic conversations about current and trending treatments, best practices, and the real issues people face with modern beauty standards. Any information or advice given is general in nature. You should consult with a healthcare provider before undergoing any treatment.
Hey everyone, welcome to our third podcast. This is Aesthetics Unfiltered with me, your host, Michelle Jones, and our co-host, Melanie Torres. Welcome back. Thanks for being here. Today's going to be a little bit more unfiltered. We are dedicated to this podcast, but life is happening and my cat is dying, and my cat is literally my child. So if I start bursting into tears on this episode, you're getting to know me well. But one thing about me is I'm very direct and I can't BS anything. But I need a distraction from my life. So I'm happy to talk about aesthetics and my other obsessions. So I'm here today. So how's your week going, Melanie?
It's good. It's been kind of all over the place. I'm glad we're finally recording this. I know we had some roadblocks, and then today you had the cat emergency. I love Whiskers. I'm sending my prayers to her.
Thank you.
We're finally
She's
here.
Literally my baby.
Yeah, and it's animal illness is so sad, but who knows, there could be a miracle, and we're just gonna hope for the best and just give all the love we can to her when she gets back to your house.
Thank you. Today I took 3 rounds of makeup up and in my eyes, and I have 2 filters on me plus some lip gloss to get on this podcast and look at myself, because it was a rough morning. Sometimes I like pets more than humans, so I'm just being honest right there.
And my lighting doesn't work right now, so whatever. We can, I don't really have any filters on me right now, and it's dark in here, but
you look great.
Thank you.
You look good. I wish I looked like that without a filter on.
We'll be able to do something.
Well, our topic today, hopefully this is entertaining for all of you. But we hope to be educational as well. So we're hitting a little bit of everything. But last episode, we went on to trends in our industry. And this episode, I thought we could go into more trends and aesthetics and deep dive a little bit more, and maybe even talk about some celebrities that we know and what's going on with their faces, or if we even have the right to talk about someone's face if we don't really know what's going on. That's kind of shitty too, right? So let's just talk.
I think we should when we do the celebrity part, I think we can just be, respectful and just be truthful. It's not like we're trying to bash anyone.
Yeah.
But celebrities are they're in the public eye, and they put themselves out there, and we all do. And let's just know that they're great performers, and that we are just trying to be honest from a aesthetic standpoint.
Yeah, I like that. I think that's our motto, is just to have some honest feedback, and kind of science-based as well. A lot of our industry is science, but it's also opinionated because it's art, and a lot of it's just experience. So, I do think it's interesting this year, what I'm seeing in terms of trends is we're moving away towards hyaluronic acid filler a little bit, and we're going more towards biostimulatory stuff. And I see a lot more Sculptra, hyperdilute radius. We'll go into that a little bit more. I see more laser stuff. I see more plasma, PRP and PRF. I see microneedling now has an even bigger comeback. And it's kind of funny because these are all the basics in our industry that are now we're all back to basics again. It's kind of like the 80s. The 80s are back, So what are you seeing, Mel?
I think we talked a little bit about it last episode, we kind of did a summary of them, but today I'll just talk about one of the most popular treatments I do that's really trending in aesthetics, and then I can talk about the MOXI laser from Sciton and just how I do it, and then since you're a Scupltra trainer, you can really talk to us about that treatment and why it's trending and what it does.
I love that. Yeah, I love MOXI. I wish I had it in my clinic personally. I'm going somewhere else to get it because I'm obsessed with it. So Yeah, tell us your feedback with MOXI and what it is and what type of laser.
Okay, so MOXI is a non-ablative laser that has minimal downtime. It is a quick procedure. It takes about 10 minutes, and what it does, it helps the pigment of your skin. It helps induce collagen. It helps collagen production, and what it really does is a quick way of doing a resurfacing treatment that is pretty cost effective, and it's really targeted to like younger patients. It's really big on TikTok and Instagram because of the low downtime, and any skin type can do it. So it's a 1927 nanometer laser. So what that type of laser does is it just focuses on like the epidermis and like the dermal layers of the skin. It doesn't go super deep. So what it's really targeting is pigment. Like how it gets there is it targets the water in our dermis. And then this part, even though I've studied lasers for years, even though like it targets the water, I'm still confused on how when it targets the water, it takes away pigment. And I'm gonna need a physicist to kind of tell me that.
Yeah.
It's hard to understand it, but I was trained on it. But so it targets that, and then it makes tiny like microscopic injury. It doesn't burn the skin or make the skin go away, but the little tiny pinpoint lasers go down into the dermis, and then that hits the water, and then it helps cellular turnover, and then the pigment goes away. So it helps sunspots, it helps brown pigment, it can help melasma, and those little spots get darker on your skin for a few days. The downtime is probably like 3 days. And when I mean downtime, it's not like you have to stay home. It's like you just get some dry skin with some little tiny, brown mends, they're called, on your skin, and it's coverable with makeup. And then after 3 days, they kind of slough off themselves, and the dryness goes away. And then after, on day like 4 for me, just because I've done a lot of treatments, I don't have that much downtime. But some people that have never done a laser, those little brown microscopic spots maybe last up to like a week, and then they kind of just flake off by themselves, and then you just have less pigment, and your skin is smoother, and you look great. And then usually people do like 3 treatments over like 3 to 6 months. Sometimes if they want something ready for like a wedding 3 months from now, you do them 1 month apart. But sometimes I tell people to do them 2 months apart, just to kind of really see how their skin heals and make sure it's back to its baseline. And then you can see the result you get, and it's a visible result in the pictures. We can even show some pictures right now if we want to plug in some before and afters, or what the skin looks like right afterwards. And then once it's all healed, it takes 6 weeks for collagen to start growing back itself. So you actually see the result. The pigment goes away after a week or so, but you really start seeing the skin health and the quality of your skin improve once the collagen starts building back up around 6 weeks after the procedure. And then for maintenance, you can get a good result with just doing 1 treatment, but usually I recommend like 3 of those treatments. And then to maintain it, you do it every like 6 months, I would say, like twice a year. Once your skin health is like, once you start medical grade skin care, once your skin looks really good, to come back in 6 months, or do one before the holidays, do one before your birthday, and then do one at the end of the summer, because we all get more brown sunspots during the summer because we're outside a lot more. So come back in like in September after your summer holiday and do a treatment, and then that, it lasts. The pigment starts mildly coming back maybe like 4 months, I would say, as you start seeing a couple little brown freckles come back, or a little bit of your sun damage come back, but it's not as much as it was before you got laser. And it's a really like cost-effective treatment depending on where you are in the country. It's like anywhere from like $600 to $1,000 a treatment, and and you can do your face, neck, chest, arms. Some people, I did a whole woman's like body, like she wanted all of the sunspots off of her arms. Too. So she did her arms.
Put me on there.
She did her arms, her shoulders, and like her back, and she loved it.
That's awesome. That's such a great description. That was really detailed. I love that. I think it's hard. There's so much confusion around lasers out there. I mean, I think what makes the MOXI special is that it treats all skin tones, which I think is really nice. And it treats, it's specific for pigment. And it's a Fraxel type laser. It's like the newer version of Fraxel, basically. And, most people have heard the term Fraxel. So I think just everything's packaged in like a different terminology. But I tried it. I really liked it because I had really stubborn pigment that I couldn't get off with like the BBL, which is broadband light, or IPL. And that technology's been around forever. And that's really good for like darker sunspots on you. But if you have more stubborn sunspots that are like lighter, it's harder and it takes more energy. So yeah, I felt like the MOXI was pretty cool. It's pretty similar to like Clear and Brilliant too. I think it's like a stronger version of Clear and Brilliant. And a lot of people have heard of Clear and Brilliant, but they're all kind of packaged. They're all kind of the same wavelength and doing the same thing with just different intensities. But that was really good. Yeah, I think MOXI is good for everybody. And I think, pigment makes us look older regardless. And I think we forget about those things because we're so hyper focused on like filling our lips or our cheeks. But like we forget about the basics of pigment.
Yeah, with me, I actually, a lot of people say injector or like I'm an injector, but I actually am an injector, but I actually do treatments like with lasers as well. Like I'm not just an injector. I look and see what the patient needs for their face, what their goals are. And a lot of patients come into me and they're anti-filler and they want to work on their resurfacing and their skin. So, first I'll do a series of that. And then, I customize the treatment plan into like what they need and what they want. And I'm never like, oh, well, I only do lips, because that is kind of like, that's not really taking care of aesthetically. That's, it's kind of like, well, you should offer laser too, because most skin has pigment and needs that too. It's like, I'd rather have good skin than good lips, personally, 1,000,000%.
Me too.
Yeah.
I think skin it can be hard because it takes a lot more work between like skin products, lasers, chemical peels. It's confusing for people. I think the injectable part is more like it's a little easier and straightforward, but like the pigment part, people just ignore sometimes because it's too hard. And like,
I think in LA, they're more about skin quality. I think because a lot of people are actors and models and entertainers, and you can't have like different features or else you won't get work. So people come to me a lot for like skin quality, because as an actor, if you have good skin, that's good because you can see yourself up close. And it's like a lot of actors can't get injectables because it changes the way they look.
That's actually so true. I didn't even think about that.
So that's like an LA thing. But also I think that, adding on, the MOXI laser is a great first treatment because it's minimal downtime, not too expensive. Younger people do it as prevention, and it's a cool way to see what like a CO2 laser does, or like even the ones you guys have at your clinics, like the halo laser. I really like to do a dual treatment of BBL and MOXI the same day because it's on the same machine, and it's like a couple $100 more it adds on, and then you can target your broken capillaries, your rosacea, and then go over to the MOXI and do your like reconditioning the skin and the dark sunspots.
Yeah, that's great. I mean, we can go over so basically lasers are on trend is what we're trying to say. And like some of our favorite lasers are MOXI, Halo, and BBL. So we'll briefly touch on to Halo and BBL. So Halo is like a sister to MOXI, and it's kind of almost identical technology. And it makes little punctures in the skin with laser heat, kind of like microneedling, but with laser. And there's 2 wavelengths on Halo, and one goes superficial and one goes a little deeper. And the one that goes deeper is like a collagen builder. But in terms of going deeper, it's still less than like microneedling depth. It's usually about like 1 millimeter deep at the 1 millimeter depth at the max. And our skin is like 2 millimeters, the dermis, and then, microneedling usually does like 2.5 millimeters. So it's a little more superficial, the lasers, but they're more like condensed and concentrated. And the superficial wavelength kind of makes micro punctures into the skin. And then the skin basically peels over about 4 to 6 days, depending on how intense we program the laser. So you can make the Halo laser really intense or like more mild. And so the halo is not specific for pigment though. And it's more like for like collagen texture. It does a little bit of pigment, but the MOXI is more like specific for pigment. So the halo is more just like an overall glow up, skin health, fine lines, wrinkles, some sunspots. And then I think of it more as like an overall anti-aging treatment, but because you peel like a good amount, like you're going to get off all that dead like skin that's not healthy. And so it ends up helping your pigment quite a bit. But if you are like specific for pigment, then I would do the MOXI.
Fraxel.
But if we combine the halo with the BBL is like specific for like pigment and like redness. And that's the BBL stands for broadband light. And that's like, it's not technically a laser because the laser is one wavelength, but it's like different light wavelengths that go into the skin that are specific for red, brown. And so it just like helps the complexion of your skin, helps diminish pore size. Really, you can program it more for pigment or more for redness. But if you combine it with either MOXI or halo, it's pretty cool because there's not a lot of downtime with the BBL. But it is a little bit more aggressive towards the pigment. And so if you combine it with that halo, you're getting like collagen, texture, plus pigment. So that combo is pretty awesome. I recommend to do it minimum once a year. That's like, I hate doing it, but I love the results.
Right.
But even if you do that once a year, I think it's like, you're going to look better because you're like getting off all the sun damage from the prior year. Your first treatment's always going to be the most dramatic because you have the most like pigment to correct. And the years after will be more maintenance. But those are, I think, the top 3 lasers that we're seeing right now. What would you think so? Would you say the same, Mel?
MOXI is just really big on TikTok. I think Kim Kardashian did one last year or something, and everyone started coming in for it. A lot of influencers will come to me and like they do little stories. I have like 2 of them on my Instagram where,
cool.
yeah, these one podcaster girl and then this one girl, she's really cool, Marissa. She does like, she talks about each treatment that I do on her like in detail, and she'll do like videos of like post 12 hours, post 1 day, the healing process. So she's super educational on it. But yeah, young people love it, and it helps melasma. Even though it's marketed as safe for melasma,
That's right. I forgot about that.
I
That's really
still
important.
see the melasma come back. Yeah, it helps it. It doesn't make it worse, but just know that if you have melasma, they'll recommend MOXI, but know that the melasma is so stubborn that it comes back a few months later. And I think people that have really bad melasma, I'm just being honest, like it'll go away and that's great, but just know that that's like a hormonal condition that it'll come back. Unfortunately, there's no like cure for melasma. I've gone through bouts of it before, and like it's stubborn. It has a mind of its own, but MOXI is really great for darker skin tones that have never been able to use a laser, and I love doing it. All nationalities can do it, all ethnic backgrounds, all skin types. I've done it on skin type 6 before, which is like laser. You could not do it on darker skin for years, and like it's just really cool that I can do it on every type of skin now.
That's awesome. I really like that about the MOXI. Just is so versatile. But yeah, back to melasma. That's a kind of a cool topic. I mean, melasma, a lot of people have it, and it's like splotchier pigment that's more hormonally influenced and gets worse with heat, the sun, hormone changes, pregnancy. But this laser, MOXI, claims that it can help with that. But I think any kind of heat is hard. And if you're doing something like that, you want to be on like a topical like tyrosinase inhibitor, like something that inhibits the pigment from getting worse. And we have lots of different products. Some are prescription, like hydroquinone, and some are non-prescription that are meant to like tell those little like pigmented cells to stop replicating as fast, and they're non-hydroquinone. So also chemical peels are probably, they are good for melasma because they're not like heat. And there's a specific chemical peel called Cosmolon that we do in our clinic. Our estheticians / medical assistants do that, and it's pretty awesome. It works really well. It's just like a lot of downtime. That's the bummer. And then the other thing is like oral tranexamic acid. So that's like the latest craze, but that's kind of scary because if you have any history of blood clots or you're on a like hormone replacement, it's a risk of a blood clot, so you have to be really careful. But on a really low dose, it's relatively safe and kind of amazing. I've seen melasma clear up really awesome on oral tranexamic acid, but definitely do the research. So at least there's more options for melasma now, because back in the day, I felt like there wasn't as much knowledge. There wasn't as much, the chemical peels weren't as good. We didn't know about the oral tranexamic acid, or at least it wasn't as mainstream. And MOXI wasn't around. So that's kind of cool that at least people with melasma have so many more options.
I really always recommend, medical grade skincare is super important. Like in my clinic, we have great brands. I always recommend to all of my consults. Unfortunately, we don't sell it. I know you guys do ZO Skin Health, because
I like that brand,
focus on acne patients as well as like melasma patients. And they have a flagship store in Beverly Hills, and you can go and like they have providers there that can prescribe you like the hydroquinone treatment. And so ZO Skin Health is always good to go to if you have the melasma or acne.
Yeah, I think just medical grade skincare, and we'll have some more episodes on what that means, because we have so many cool, amazing products right now that are, not Sephora, not what you would get like on Amazon or Sephora. So they're medical quality, but we'll go into that later. The other things I think are trending, which I know are trending, is Scupltra, which obviously I'm a fan of, and hyperdilate radius, which I'm just starting to play with a little bit. And those are just like injectable treatments that are not filler, but kind of their own category, and they're called biostimulators. So we inject them and they tell your body to create more collagen. And so it's kind of nice because you can program these different treatments to build more volume or just be a skin texture improver. And, everybody needs skin quality improvements, and that's what's pretty cool. They build collagen, so they do a little bit more for us rather than just filling, but they have their limitations. We still need filler, they're not as precise as filler, and you can't really use them around the mouth area or under the eyes. So they're still, and it won't like project a chin. They're more just like globally helping the health of like your skin and the quality of your skin. So, but those are really booming right now. I love Scupltra. I can go into that. It's basically an injectable biostimulator. It has water and polylactic acid, and polylactic acid is like ground up suture material basically. So if you went to the ER and got like a little stitch in your finger, same type of material ground into a powder plus water. And then we inject it, and it creates like type 1 collagen in your skin quite a bit, even after one treatment, which has been studied. This is like a very studied product. And, if you do one treatment, it will definitely help your skin quality. It might give you a tiny bit of volume depending on your age, and it's complicated. That's why we have these consults. But 2 to 3 rounds probably will build some volume, so it can act like a filler. But the nice thing is the collagen it builds can last for a long time. It's kind of like you're banking in that collagen. The half-life of collagen is 14 years, so it's pretty magical. So I do a lot of that. Right now we're doing more booty Sculptra. It takes a lot, so it's a little on the pricier end. But
what does it do? What is when you say booty, does it like change your shape of your butt? Does it just help like the dimpling? Like I don't do booty treatments. Like I love it. Personally, I know you do. So
I'm
like
ready to see an ass at any time.
So
sick of
what
faces right now?
What is the outcome? What do you see at the end? What is the last result?
I think it's kind of fun. It's not just like putting it in there. I mean, you really want to assess someone's booty and be like, okay, do they want to focus on their hip dips and filling those out so they're like a little bit more of an hourglass figure? Do they want projection? Do they want to just work on like texture improvement, helping cellulite? Like, do they want a little bit of volume all over? Is one side asymmetrical? Like, what are we trying to achieve? So we definitely have those conversations. Like, some people want to be a little curvier. Some people want projection. Some people are asymmetrical. Some people have a flat spot in the middle. You know, butts are just like faces where they're all so individualized, and it's like you can't, it's kind of fun.
I mean, do you get like a Kim Kardashian butt as your last treatment? Is it just like a little bit of like subtle volume?
It's just a fluff. It's just like a fluff. I mean, it depends how many vials you put in. Like, really, it takes a lot of Scupltra to like get a lot of volume. You know, minimum 20 vials, sometimes 30.
And then how
more.
long? How many treatments?
I mean, the max I'll do in one treatment is like 20 vials. But usually I do like 10 vials, and I'll see them in 2 to 3 months and do another 10 vials and sometimes repeat. And it's nice because it looks very natural. It just kind of fills it in and it feels kind of light and fluffy. And I would say a good like 10 to 20% volume it can do. You know, it depends on the surface area of the patient too. And that's the thing. You have to be a little bit picky where you put it, because if you're just spreading it all over, you're not going to get as good of a result as being really precise and like pocketing that like product to be the max projection if you're trying to do volume. These are for people that like surgery, like a booty lift or a butt implant is like out of the question, or a fat transfer to their butt is just like unrealistic. Some people are really skinny from Ozempic and they don't even have enough fat now to get a fat transfer to their butt. So that's like out of the option. Implants look weird to me personally, but I'm not a surgeon. I just haven't seen any that I'm like, oh, that looks amazing. But I mean, to each his own. Everyone has their own aesthetic. It's just not my aesthetic. Some people want that. That's definitely not what the injectable products will do. I think the best candidate is like someone who just wants to like maybe lost weight and just wants a little extra fluff so their butt doesn't feel like it's aging like their face, or somebody that's a little bit tinier that like those are, if you're a little bit on the smaller framed and you do a good 20 and you're healthy, then you'll probably get a nice result. But I still haven't done mine, but mine's coming. I'm going to do it for sure.
You should, but I want to see like a before and after of a booty. Like,
it looks very natural. Like the ones I've done, they look very, very natural. So it's not like dramatic. It's just like, ooh, my butt looks healthy and bouncy, you know? And yeah, it just looks like healthier. And like, if you put more volume at the top part of the butt, then like the bottom part doesn't look as saggy.
Okay.
It's kind of an optical illusion.
I need that. I want to do that. If I did it,
I think you would like it. Actually, that's what I want to do for mine. It's kind of like as we age, the top part of our butt gets flat and then it sags. It's just like our boobs. So by adding a little bit of volume at the top, like it kind of fills it in a little bit more symmetrically and it just looks a little bit more youthful. It's not anything crazy.
Right. It's a subtle enhancement.
Yeah. So I think for me, it feels like very like anti-aging and like it's very safe, where we know there's been deaths with like butt implants and fat transfers, and it's kind of a sketchy like surgery sometimes.
And it's it's completely like, it's like an implant in your butt. Like I feel like the Kardashians, like she probably likes it now because it makes her waist look thinner. But like, I remember when she lost weight, she was like, oh, I wish I hadn't done the BBL Brazilian butt lift because...
Well, they took it out, right? It doesn't look as crazy as it used to. No, they took it out.
Really?
Yeah, they did.
Well, she still has like a
it's
huge...
definitely smaller than it used to be.
She still has a huge... I mean, I don't think they did because she's lost so much weight. Her waist is the size of like... And her butt is still so huge. Like, I doubt she took it all out, for sure.
Well, if she was transparent, then we would know. You know, we know everything else about her life. I love her, though. It's just like, let us know.
Right.
Let us know, Kim. What did you do?
Maybe she did say it. I don't know. We did.
I think she took it out. Like, there's no way. Because like 5 years ago, we'll ask the audience. Like, please DM us your thoughts. Because I have no idea.
Because I remember I heard an article when she lost all the weight for the Marilyn Monroe dress. She's like, I'm bummed that I did the Brazilian butt lift because now that I'm thinner, I still have such a huge butt. That's what I remember. But yeah, guys, if you know anything about it, DM us and we'll
DM us. Let us know.
We will like let you guys know what the truth is.
I thought all of them took them out. That's what I thought, because I thought they looked a lot like, because wouldn't their butt look bigger if they lost weight?
It does, and that's why she was bummed. That's what I think that's what she said. I can Google
no
it.
idea.
I would Google it, but I'm on my phone right now recording
I don't
this.
know. Apparently I'm out of the loop, so I have no idea. I just thought it looked better. So anyhow, yeah, there's options. The other option is hyperdilute radius in the booty, and that's similar to Sculptra. It's calcium based and it lasts a lot longer, but it's more permanent. I think the half-life of what I heard with calcium hydroxyapatite, which is called Radiesse, is about 15 years. Kind of cool. I think it feels a little bit bouncier in your booty. So if we're liking the Sculptra, sometimes we'll go to that for a more permanent kind of outcome. So those are like the two, I would say, most common, safest injectables to the butt. I think filler is a waste of time. I've seen in different places people putting in hundreds of mLs of filler. I don't know. I've seen more reactions online with that. I just think it would fade faster and it's kind of like pointless. But that's I'm not educated because I don't do all that filler in the butt. I just think it's riskier too with the gel getting into a blood vessel. I just think it's kind of crazy. With when we have these other options that are like stimulating your collagen, helping your cellulite and things like that. But yeah, that's on trend. So we're still on topic. Yay.
My favorite place for Sculptra is, you did it on me the first time. We can roll, like, I still have the video of you doing it in my décolleté because it helps the crepiness.
I love it.
It's super safe. You only need like 1 vial versus 20 vials for your booty, 1 to 2 vials here. And it just gives it takes away that crepiness as we get older, like the little fine lines we get when we're wearing our bikinis. So yeah, if we roll, I still have that. I'd love to show them how you do it. It's super easy. I did one the other day on a patient, and she came in for actually a MOXI laser, and then I was like, and we were doing her décolleté area, and I was like, well, we have Sculptra, and a lot of people don't know about it, and it's just such a easy 15-minute treatment, and it just subtly, and we did it together. It just subtly just makes it smoother in your décolleté. We did it like 3 years ago. I think it still is in my décolleté. I'm ready to do one other vial now because it's been almost 3 years since we did the video. But I love it. It doesn't hurt. You use a cannula and you do like 2 or 3 little places. You do a little bit of lidocaine. So the entry point of the little needle is, you don't feel it. And then it takes like 5 to 10 minutes to just, evenly distributed under the skin.
Yeah, that's good. Yeah, I think that's one of the like areas that it works. It's like not a lot of product, so it's not that expensive for what it produces for you, and it works really well in this area for like those sleep lines when you're sleeping. Because if this skin is denser when you're sleeping and your boobs are all smashed together, it's gonna. As that skin gets crepier over time, it needs a little extra cushion. And if you put the Sculptra in, it bounces back faster, which means you have less lines and less sagging. I also like putting in like I know you don't do smooth threads there, but I like the little smooth threads in there because they're just like extra support there. They're just like collagen builders and it's really easy. So yeah, I think Sculptra in the décolleté is really good. I've also heard hyperdilute radius is good there. I haven't tried that yet.
I'm looking at myself, and I have a Sculptra question for you when you're done talking about that.
Yeah.
So I was doing a little podcast last week, but anyway, we were talking, and I filmed it like on a diagonal, and I saw myself talking the whole time, and I was like, oh my gosh, I have jowling now. Like it's. And as soon as I saw the video, I was like, all right, I'm going to get I did jawline Botox like the next day because I'm 48. And I was like, oh my God, this is the first time I've seen jowling, the pockets starting to come here. The lighting is lower today. So I'm going to look at this video after we do it to see if I still see it. Maybe the Botox helped it. But do you think it helps?
Tight to me.
Well, the Botox worked great then, and maybe my DAOs got
let's
knocked
talk
out.
about that because that's super on trend right now. The Nefertiti Botox lift, everyone's doing that.
Yep.
So
do you
that
think
might be a good
topic? Quick question: do you think Sculptra would help the jowling if I still have it? If you did it, do you do Sculptra on the jawline ever?
I do a lot of Sculptra, like preauricular, like the area right in front of the ear, and I do it on the jawline. And what that does is it can fill in that area a little bit, but it also can like tighten that skin a little bit. Tighten is a scary word because like, it depends on the patient, how much you're building, but I do think it gives the skin some traction. So I think that's one of the best places to do it, is like in this little area. I have like a ton of Sculptra in this area. I probably do it every other year just because my face thins out really fast in that area. So if I add some density to that with Sculptra, I feel like it makes me look more youthful and it tightens it up a little bit. So yeah, I think that's an amazing. You just don't want to put it in the jowl, obviously, which because you don't want to make any more volume in this area where we're already kind of like sagging over time. But if you're kind of surrounding it and camouflaging it, I think one of the best places to put it is like in the preauricular space. And a lot of people are doing like hyperdilute radius in that space too, but that's a little bit more permanent. So it's like, I prefer Sculptra. But that's like my number one space to do it, is exactly what you were saying. So we should do that again for you.
Do you ever do like 2 boluses here into like the pre-jowl or not? I've seen that in some trainings. You don't?
No, I think filler works better in the lower part because it's more precise in terms of how much volume we're building, and the muscles are so dynamic that we don't want a nodule and we don't want a lot of fluid in there. I mean, if the person's really hollow in there, I will get a little bit sassier and I'll put more in there, and I haven't had a problem, and it acts as like a strengthening for the skin, and theoretically your filler could look better on top of that, but it's not my number one go-to. But everyone's doing all different things, and it's not that it's wrong. It's just like we have so many options now. It's kind of like, what do we think will give like the best result? I still do it superficially for the skin in the pre-jowl sulcus area because I think it strengthens that skin. But in terms of building a lot of volume there with Sculptra, it's a little more unpredictable, and I would probably just stick with filler. But it really does help the strength of like the fine lines through that area. I think it does a great job for. So you probably will need less filler if that skin is stronger, right? So,
well, I think the main, just because like if listeners here are like totally new to aesthetics, because I heard about this in a dinner, I was at a aesthetics dinner, and so an injector, a provider raised their hand and they're like, so these are the areas you do not do Sculptra in, guys.
Oh, really?
If you ever go,
Where?
You don't do it in the forehead. You don't do it under the tear troughs.
Correct.
And someone said, oh, hey, what about your thoughts on Sculptra in the forehead? And you don't do that. You don't do it in the lips either, right? Yeah, those are like areas that are a no-go because of the thinness of it, and it's too superficial. All right, guys, sorry about that kind of crazy little pause. Michelle's just having emergency with her beautiful cat Whiskers, and I hope you enjoyed episode 3 of Aesthetics Unfiltered. See you again soon for our next episode. It's been so much fun just talking about life and aesthetics.
I love it.
You can follow us on our socials, myself at melanie.skin.np and Michelle at skin.smarty.np, and then at aesthetics.unfiltered.podcast. All right, guys, see you again soon.
See you soon.
For our latest news, follow us on Instagram at aesthetics.unfiltered.podcast or in our personal pages on Instagram.
Mine is melanie.skin.np and Michelle skin.smarty.np, both on Instagram. Have a great day.